On this episode of Plastic Surgery Uncensored with Dr. Roddy Raban, we're going to go into implants. And this is very personal for me. I'm going to call it blessed with an hour of your time in which we did a deep dive on, we did a Chi-Chi deep dive. And that I was fascinated by how much I didn't know when there's so much out there about implants. So can we just start from the very basics, Dr. Raban?
Like everything, there are pros and cons, right? And the problem is it depends on what side of the coin you're on.
Okay.
Obviously, if you are blessed, as was my sister, to have had breast cancer reconstruction with implants, you find implants to be a lifesaver. If on the other side, you're a patient who had breast implants and as a result had capsular contracture, you might not be as happy. So I don't necessarily know that we can be so black and white.
Okay.
And I think the problem that we're running into right now, and again, we're having this similar surge that we had in the past, is that implants are sort of a hot topic and sort of getting, I believe, a bad rap. So let's try and see if we can clarify what it's all about.
Okay.
So implants in general, breast implants, let's be clear. Breast implants come in different flavors and different sizes.
Okay.
So let's break it down into simpler things. So there's saline and silicone implants.
That's it. There's two types.
Sort of. There's saline and silicone implants. When you go and see the manufacturing process of these implants, they kind of start out as the same implants, and somewhere along the assembly line, they break up. So the thing that's ironic is that people for a long time were saying, oh, the issue is silicone.
I remember hearing that.
Right? Silicone is an issue.
A big thing.
And as a result, we're going to avoid silicone and be dealing with saline. The problem with that thought process is the outer shell of a saline implant,
okay,
basically the bag, is silicone. So what your body is in contact with is actually silicone. So we're going to come back to that. So basically a saline implant is a glorified water balloon.
Okay.
It is a balloon made up of silicone. So it's a bag and that you fill in during the operation with saline or water. A silicone implant is a pre-manufactured bag that has silicone gel in it and sealed and closed. So what are the advantages and disadvantages of each of them? And then what are the subtypes of each? In the saline implant world, what are the advantages? Number one advantage is that because the implant is deflated before it goes in, it can enter in a very small pocket. So when you're putting it in during surgery, if there's a small areola or whatever, you can get it into a smaller hole. A silicone implant comes fully pre-made. You can't take any fluid or anything out. So it's got to go in through that the whole implant's got to go in. The second advantage of a saline implant is
but not to interrupt you, but even that concept, I've never knew that you put something in like a rolled up empty balloon and then fill it.
Yes, it's like a rolled up taco. You roll it up and you stick it out, it's going straight for, and you put it in, and then you have a tube that comes out. It's like a little hose, and then you start filling it with water, and you fill it up number of cc's.
Like a water balloon.
I said it's a glorified water balloon.
So how do you know when to stop putting water in, and how does it seal that you know the water's not going to come back out of it?
So you know how much water to put in because each implant has a cc, and then you're counting how many cc's you're putting in. So let's say it's a 250 cc implant. You usually overfill it to like 275, and it seals because there's a little seal where the tube comes out, and when the tube pulls out, the seal goes in automatically. So that's how the saline implant works.
Okay.
So the other advantage of a saline implant is that if it were to rupture, and nowadays rupture is incredibly rare, but these implants are very well made, you'll know immediately. Why? The balloon will rupture, the saline will disappear, and next thing you know, your breast will deflate.
Your body just takes in the water and you have a flat tire.
Correct. All of a sudden you'll wake up one morning, and I've gotten many calls like this, where all of a sudden you'll be like, uh-oh, and then it's sort of not an emergency, nothing's going to happen to you, but it's kind of urgent. And as a result, you kind of want to get it done relatively quick because you're lopsided.
And you compensate until you can get in.
You put in
sock,
fillers,
that's what I used in high
or
school.
things like that.
Yeah.
So those are the advantages of saline implant. The disadvantage of saline implant, in my opinion, and some of these are sort of opinion driven. Number one, it's very round and very projecting. So that means that the implant, we always talk about patients come in and say, oh, I want to look natural. Well, it's very hard to look natural with a saline implant because it's super round implant. And when you fill it up, it becomes very projecting.
Because you can't control
it's just a round balloon.
Goes. It's a balloon.
Just a balloon.
Got it.
So it's very projecting. And when it's very projecting, it tends to look a little bit fake, especially if you're a thin-girled woman. If you're a very thin woman, you're going to look super fake. Second reason I don't like it is they're not very compressible. So when you give someone a hug, if you feel like you're bouncing off of them, chances are high that they have a saline implant, right?
Okay.
Third is they tend to cause a lot of fullness in the upper pole. So again, back to the sort of, I refer to them as Vegas breasts. Depends on, but they're going to look very fake. They tend to ripple more. What is rippling? Rippling is either seeing and or feeling the edges of the implant. So when you rub your hand along the edge of the breast, or when you're looking at someone who's very thin, sometimes you can see the ruffling, kind of like the ridges of a rough, like
I saw that on a stripper in Minnesota.
Yeah.
It wasn't pretty.
Yeah. It's not desirable.
Story for another day, but no, it wasn't good.
So there tends to be rippling, and that's sort of undesirable. Okay. Mm-hmm. Then we move to silicone. What are the advantages? So then in silicone, you need to divide it now. Now we have a lot more options.
Okay.
So the question with silicone becomes is what kind of gel is in it? Gel can be super soft and we call semi-cohesive, kind of like gel, like the gel that you would expect, like it's sticky and gooey and gel, all the way up to what's called cohesive, which is a solid block, solid implant. So we have semi-cohesive and we have
the squish
cohesive,
factor.
Right? The cohesive one today is known as the gummy bear implant. It's very popular in terms of its nomenclature.
Gummy bear?
Gummy bear, because when you think of a gummy bear, if you cut it in half, it's solid. Nothing oozes out of it.
Right.
That's where the gummy bear concept came from.
Oh.
So let's talk about silicone implants. So the soft semi-cohesive implant, which is the workhorse in the United States, I would say 90% of augmentations in the United States.
90%.
Of general augmentations, cosmetic augmentations, are done with a semi-cohesive gel implant. What are the advantages of that implant?
Semi-cohesive gel, but there's a variety of gels.
Each company makes a different degree of cohesiveness, which means how soft it is. But let's just put them into two categories.
Okay.
Semi-cohesive, soft, cohesive, solid.
Gummy. You got squish and gummy.
That's it.
All right, good.
In the semi-cohesive soft category,
okay,
the advantages are that it feels supernatural. I think it's, in a woman with a little bit of breast tissue covering it, you'll almost never know they're there. It tends to have softer or less rippling, although it still has a little bit of rippling.
Okay.
It can be entered into a small opening, maybe not as small as a saline implant, but definitely much smaller than a gummy bear implant that doesn't collapse at all.
No, gummy's just hockey puck. Yeah.
And it tends to be, these implants are round, so there's no orientation issue. In other words, you don't have to worry about that you put it in the wrong way. It's round. There's no top, bottom, or left or right.
Okay.
The disadvantages of a semi-cohesive gel implant is that technically it's round, although in this instance, this round is different than a saline round because a saline round is very stiff, so it looks very round, but a soft gel cohesive round is really squishy, so you can't really tell it's round.
And it's affected by gravity.
Gravity, yes, that's true, but saline, it doesn't do it as much. It stays round and stiff. The second advantage is that if you were to rupture, the gel would kind of eventually ooze out a little bit. It's not going to stay inside the implant. Okay. And we'll talk about what happens when it ruptures. Those are the advantage and disadvantage. Now, the gummy bear implant, which has been in Europe for many years, which made its launch in the United States a few years back, it hasn't really gained as much popularity in the cosmetic arena. It's very popular in the breast cancer reconstruction. I'll explain later. Because it's got some challenges. Number one, it is solid. So in exchange for...
It's got to be hard.
It's firm. So it's firmer.
Okay.
Two, it can't be...
I'm thinking of the texture of a gummy bear. Right. That's the thing.
Two, it can't be placed through small incisions. It has to be placed through a larger incision because it doesn't collapse like a soft gel.
Okay.
And three, it's oriented. So there's a left, a right, a top, and a bottom. It's teardropped. And people at first are like, wow, that's great. It looks natural. But the problem is that if it rotates or goes to the left a little bit or the right, it's malaligned. It's not perfectly centered.
And you can't just line it up again?
No.
Okay. I didn't know you could
there's no adjting before you go out on a date.
It's not like a dude where you guys are always adjusting all your business.
No shifting into place. Okay. The advantages are that it is solid. So if it doesn't rupture, it's a block. It's not going to rupture. And the other advantage is that because it's solid, there's no rippling. And if you put it in perfect and it doesn't rotate, theoretically, it creates a teardrop. Now, I'm not going to tell you which implant to use because there's no way I can tell you that because it's very person to person and it's based on your anatomy and the dialogue you have with your surgeon. But you need to know each of these elements so that, again, when you make a decision, you're making what's called an informed decision. You don't want to walk into your doctor and be like, oh my God, my girlfriends, we were in Vegas and they have the gummy bear implants. Their breasts are gorgeous. I want a gummy bear implant. That's crazy.
I'm sure those are conversations that happen every day in this town.
Yes.
That's what's happening right now.
Well, I've had the conversations, so therefore I know that's what I'm referring to. So you don't want to have that conversation. You don't want to go into your surgeon telling him, I want this, because you don't know that that's what necessarily you need. Now, in terms of breast cancer reconstruction, that is after you've had a mastectomy, which means you have no breast tissue, no nothing.
Right.
No doubt the gummy bear implant is outstanding because you're basically building a breast out of the implant. And of course, you want it to be more shaped than round, et cetera. And I think it has done incredible in that arena. In the area of cosmetics, it's arguable as to whether or not it's been advantageous or not. So that's in general a very kind of 411, maybe not basic because I think it's a lot of detail, but really the basic gist of the different kinds of implants.
And now size-wise, this is also very important. You mentioned cc's. Women think in terms of A, B, C, D. I think that's how we think in terms of breast size. But for instance, how many cc's goes into a D cup?
So sizing is like my pet peeve when it's done wrong. It's my area that I spend probably the most amount of time. So you come in for an augmentation and we need to educate you. So the reality is that there's no right sizing method. All the sizing methods that are done today are flawed. So you get on a scale and you weigh 140, let's say. You weigh 140. There's no arguing that. It's not like you weigh
That's
140.
rhetorical. I don't weigh 140.
I know. But let's say you weighed 140. It's not going to change if you go from your apartment to your office. If you say I need a 6 inches of yarn, it's 6 inches. But if you say I have an A cup or a B cup, it's going to vary on manufacturer.
Yarn.
Yes. It's going to vary on manufacture. Yeah. It's going to vary on style of bra. It's going to vary on if it's got padding or if it's got 100%. Lace. It's going to vary on what time of the month it is. So when a patient comes in and says, I'm a B cup, I want to be a D cup, we are already starting out in a major problem because me and you, don't know what each other's D cups are. Issue number one. Number two, when a patient comes in and says, oh, I want a 300 cc's in you may make you into a D, in your sister may make into a C. It's not the cc's, it's what the cc's do in you, not what the cc's are.
Okay, this is very interesting to me. So technically it's almost like perfume. It's going to land on your body in a different way.
Well, listen, okay, let's go. You're 5'2", 110 pounds, and you have an A cup.
Got it.
You're 5'7", you're 140, and you have A cup.
Got it.
If I put a 300 cc implant in both women, are they going to end up both being C cups?
No. I get it now.
No. So when you come in and say, Dr. Raban, I want to be a D cup, we got a problem. I don't know what a D cup is. You don't know what a D cup is. When you come in here and say, Dr. Raban, I want a 300 cc implant, we got a problem. I don't know what that's going to look like in you. The way I do sizing is different than most people because my background's in engineering and I'm a real anal guy. I'm very particular. So,
by the way, I know all this to be true, and we'll discuss my my boob journey in a minute. But yes.
So what I do is we do three different things. First, we do the verbal. So you'll tell me what size roughly you want to be. Oh, I want to be a C or D.
Right.
Then we'll do the physical. I will physically measure your chest, your diameter, the nipple to fold, et cetera, et cetera.
Your nipple to where?
Nipple to fold, the distance from your nipple all the way to your fold, the nipple to your clavicle. There are these measurement parameters. What that's going to tell me is what is the max size that's going to fit in your chest. You would never walk into Neiman's, look at the Louboutin section, see a pair of Louboutins that are on sale, grab them and buy them, and then find out when you got home that they're a size 6, yet your foot's a size 9. That's just, it doesn't make sense. It's physically not going to, I don't care if it's on sale, it's not going to fit. So when you go to your doctor and you just say wholeheartedly, oh, I want to be a D, but your breast's frame is cannot take in an implant larger than a 300, that's it. That's it.
That's all she wrote.
Well, that's the way it should be. What you can do is you can destroy the anatomy and force something in there and get some horrific outcome. So we measure you, and that tells us what size you cannot be. And this is where I'm going to be unique. We have you go through tons of photos together, and you're going to pick out implants that you love. Oh my God, look at this breast. This is what I like, Dr. Bon. I love these photos. I really like these two photos, but these two breasts are a little bit too big for me. And I really like these two as well, but maybe a smidgen too small. All those photos go on the wall. Now listen carefully. Normally what you would have done as a surgeon is in advance, when you met the patient, you would have written down in your notes, I believe this patient's going to need a 250 cc implant.
Right.
That's called an educated guess. And what will you order? You will order the 250cc implant and it'll be there in the operating room. And when you're done with this patient, what is she going to get?
250 cc's.
250 cc's. You're getting the game.
I'm paying attention.
Right. What if that's the wrong size? What if that doesn't look good? What if when you put it in, it's significantly larger than you anticipated? We're guessing. What I do that's completely different is I have a closet, and in that closet you open it and I have every single implant the manufacturer makes. I'm talking 100, 150, 200, 280, all the way up to 800 cc's.
Wow. 800 cc's?
800 cc's.
How big is that woman?
It's very big.
That's a big woman.
Yes. I have every size. Wow. I have every shape, meaning I have moderate, high profile, smooth, and textured. So I have everything in the catalog. Okay, there's 500.
High profile?
Every implant.
It's like a SUV?
Yeah.
Like, what is that?
It's 4x4. Okay, that has to do with the projection of the implant.
Oh, okay.
Okay, then for every implant that I have, now listen carefully, this is the kicker. For every implant that I have an exact sterile copy. So that means I have 500 implants in boxes and I have another 500 implants in bags that are sterile. And what I do is I look at the photos of you on the wall, I look at your frame, and then I do what I do every day is I make the educated guess that everyone's going to make. I insert the implants that I believe that are going to be right. These are the exact copies, but sterile sizers. I sit you up while you're asleep. I look at the photos and I go, that's a little bit too big. And I think her right breast is bigger than her left. Sit you down, take those out, put a new sizer in. So I don't have to guess what size you are. When I am done with your surgery, I haven't got a clue what size you are. Nor can I tell you in advance how many cc's you will be. All I can tell you is that when you show up in my office a week later and we take off all the bandages, you will look like what you asked for. No surprises, none whatsoever. So I don't make decisions on your behalf. Oh, you're the expert, you're the artist. They're not my breasts. I get you what you want as long as what you want makes sense. Now, the reason why this works is as follows. Number one, when you tell me you want to be a D and you show me a bunch of photos, then we decide if what you think is a D is what I think is a D. So many times people say I want to be a D and they show me something else. And two, and more importantly, we can fix a lot of asymmetries on the table. And so 20%.
So you might even have two different cc's
of course,
on two sides?
Yeah, of course. If you're 85% of women have.
You know, when you go buy shoes, you got to buy the pair.
Right. 85%.
They're not going to let you get a 7.5 and an 8 Louboutins.
You
got to take the 8.
85% of the patients. 85% of the patients have asymmetry.
85.
Yes. One breast is bigger than the other. And if you are a very particular person, you're going to try to fix that. If not, you're just going to put two safe implants and say, hey, listen, you're asymmetric before, you're asymmetric after. It's fine. It's acceptable, but why not fix it? 20% of the revisions are due to wrong size.
Too big, too small, asymmetrical.
I just don't like it, Dr. Bond. My revision rate in my practice is I think I've done 2 revisions in 15 years. I'm telling you, this works. Two. The problem with doing this is it's time consuming. And as we've said on numerous podcasts, it's not favorable to take time in the OR. It's expensive. Who the hell wants to slam them in? Let's get it done. Let's move on. I got 4 more that day. It takes me 2 hours to do a breast aug. The national average is 30 minutes.
Wow. Dr. Raban, you've given me so much to think about, but there's a lot of controversy still. When we come back, can we go straight into the controversies?
Absolutely. Let's talk about it.
All righty. We're back with Plastic Surgery Uncensored with Dr. Roddy Raban, and we're going to go straight into the controversies surrounding breast implants.
So listen, breast implants have been the center of controversy from their inception.
When did it start?
Okay,
in the 80s?
So no, it's in 1992 is when the shit hit the fan. But let me tell you something to begin with. All devices, pacemakers, prosthetic knees, heart valves, all devices go through an evolution, and all devices have issues, and no device is perfect. And there's heart valves that have issues. There's all kinds of things. So it shouldn't surprise anyone that we're putting in a prosthetic device into a human being and it creates issues. The issue, though, is to what degree, and is it worth it, and is it safe? That's really the controversy. The fact that it has issues is not the controversy. The controversy is it safe? So let's begin with the original controversy.
Okay, original OG
1992. I may be mistaken, but I think it was Connie Chung. It was one of these reporters brought on a patient onto one of the evening shows, and basically that patient went on air, and there was no doctor there, no opposition, no nothing, and simply said that, I've been noticing that I'm really sick. I don't remember what the exact specific symptoms were, but I believe that I have visual issues. I'm making this up. Inflammation, et cetera, fatigue, tired, et cetera.
Yeah.
And as a result, I believe they're caused by my implants.
Right. I remember that.
Right. True or untrue is not
Jenny Jones, there was a big talk show hostess that had him removed. It was a thing. It was a thing.
So true or not true, at this point, nobody knows.
Right.
This is just someone going on and making a statement. Well, as you can imagine, the next morning across this country,
oh, yeah,
hundreds and thousands of women in a state of panic started calling their doctors, and there was an epidemic. There was an emergency.
No, it was a Who Shot John. It was a big deal.
And everyone started calling saying, oh my God, I saw this show. The patient complained of, let's say, being tired or fatigue. I'm tired. I'm fatigued. I have implants. I want them out. And the fact of the matter is, at that time, there wasn't a tremendous amount of data. The implants have been around since the 60s. There wasn't a tremendous amount of data to say one way or the other. And when patients are calling panic, the doctors, really, what are they going to do? And all of a sudden, thousands of women started having the implants removed. Based on what? Based on what?
I remember that. One woman
based on a woman's
a chain reaction.
We call that anecdotal description. Okay, so she came. Now, the FDA then freaked out because all of a sudden this happened, and they put a moratorium. They said, kibosh, no more silicone implants for augmentations.
So
now,
the FDA stepped in.
No more.
You could only get saline after that for a time.
How? Not true. So where the issue was that you could not. So this is what I find to be fascinating and interesting and stupid. So
it sounds like my ex-boyfriend.
Yeah. Maybe he worked for the FDA. So you could not get a silicone breast augmentation, but if you were having a lift and an augmentation, you could have silicone.
So explain just for augmentation.
Explain to me that one. So if
semantics.
Listen, if the idea is that silicone breast implants are bad for you, or we're not sure they're bad for you, they need to be removed, period. Who could still have silicone? If you're having a lift.
Which is almost everybody.
If you're having breast cancer reconstruction. So the irony was, you're telling me that it causes all these diseases, yet if you are a breast cancer survivor and you just had a mastectomy, you can still use silicone. It just doesn't make any sense. So anyways, that's what they did. Now, mind you, around the world, Britain, France, Germany, Mexico, Canada, nobody else removed the implants off the market. As if they don't.
And technically, it sounds like we didn't either.
Well, that's true. But we tried to do something because we live in a much more litigious world than anywhere else. That's really why the FDA did it. Okay. So at any rate, that's fine. So for, I believe it was 14 years.
Okay.
These implants were under investigation. Now, as I mentioned to you earlier in the segment, technically saline implants have a silicone shell, right? So a woman with a saline implant has silicone in contact with her body. Yes, the stuff inside is saline, but what you and your body are touching is silicone. So I found that still to be ironic as well. But needless to say, for 14 years, the FDA required all the implant companies to do extensive, millions of dollars of research, trying to prove or disprove that there is a correlation between silicone implants and a host of diseases: lupus, fatigue, fibromyalgia, breast cancer, GI issues, blood tumor, you name it, whatever the concerns and or the.
I'm sure it went the gamut.
It did go the gamut. Headaches, visual changes,
blurry vision, anal leakage. It probably went on forever.
It did. And so what they did for 14 years is that they went through, as they should have. I have no problem with the fact that they did, because the study should have been done earlier, but nevertheless, they did it. And at the end of the 14 years, and I assure you the FDA at that point was not going to let anything pass, they brought the silicone implant back on the market.
Full force.
Full force.
No restrictions.
No restrictions.
Okay.
Why? Because none of the studies, and there were two manufacturers that were doing all the studies independently, because they hate each other, so obviously wouldn't collaborate. The studies never showed a single statistically significant correlation between silicone breast implants and any of these disease processes. Okay? So that was that.
Safe. So let's just call them safe. Can we do that?
We can, but we live in a world where saying that
safe.
So as far as the science suggested, they were safe.
Okay.
And we both know that there are instances where science is inaccurate. There was a period of time where people would get their thyroid irradiated because that's what they thought was the right thing to do for some disease process, and then now people got thyroid cancer. So I'm not saying that science is infallible, but I'm saying based on the extensive amount of research they did to this point, it's not. And remember this. Breast implants are like in 25 million women.
Is that all? That would just be California.
maybe even more. But my point being is that if it were something that was pretty obvious, let's say 5% of women got lupus. Let's just say that 5% of 25 million women. That's a lot of people.
Significant.
That's 1.5 million people. They're not going to just be, they're not going to be quiet.
Right.
So we would know. At least that's what we feel. So that's all done. But now we're having another resurgence. And if you're on social media and you're on Instagram and Facebook, you're starting to see another wave. And the wave is of women who are experiencing similar type chronic diseases. And as a result, they are now going through another similar journey where they're having explantation. Again, no one can argue with a patient who internally feels as though, listen, I feel crappy. I think it's my implant. I remove my implant. I no longer feel crappy. No one can argue with that.
Can I say something really controversial and unkind?
Sure. You can see whatever you want.
Maybe on some level, it's because the reason that they put them in to begin with isn't a valid reason. And now they feel better about themselves, or they're no longer with the man they put them in for 15 or 20 years. I mean, so much psychology involved in the female breast that has nothing to do with size. And I'm just going to put this out there. Women are the mirror, that's our symbol. And so much has to do with external validation, and breast beauty has become an enormous focus. When I was a little girl, you had Playboy bunnies had fake boobs. Like regular people didn't do that. And in the last 45 years, it's almost like inverse proportion. You have women's rights and glory. In my lifetime, I've seen women's lives change dramatically for the better psychologically. But on the other hand, beauty seems to be what I call the pornification. Like everybody has implants. Like everybody's boobs are important. Nobody just says, I have 1984 Snoopies. That's it. That's my life. I got Snoopies. I mean, unless you're a hippie in Topanga, everybody I know, I think 100% of the women in the room right now, and you can't see them, so I'm not outing anybody, has had some, one lady's nodding no, okay. But you get what I'm saying.
Yeah, no, and listen, I think that there's no question that there's a psychological component.
100%.
Both in the positive and in the negative. And so I can't, listen, I'm not able to.
Nobody just lives with bad boobs anymore. My mom had bad boobs when she was 29.
Listen,
I remember them.
I'm not able to comment on that, and it's not my position to do so. I just want to bring.
That's why I did it.
Right. I just want to bring light to the fact that there is what we refer to as anecdotal or empiric. This is their experience versus what the science says.
But emotional versus research.
Currently, the science, and I said the science could be flawed, but I don't believe it to be the case at this juncture.
Okay.
Currently, the science says that breast implants, saline, silicone, whatever, they have issues. They have capsular contracture, they have this, they have that, but they don't lead to these chronic conditions. And then now we have a whole host of women that believe they do. And when they explant them, they feel better. So we just need to address this. Now, that's considered sort of controversial. There is another situation which isn't necessarily controversial and is real, and is a situation called what we call ALCL. And that's a incredibly rare form of lymphoma. It's called anaplastic large cell lymphoma, and it is breast plant related. And it became known in the last year or two. I think there's somewhere near 300 cases globally. So it's not.
So that's like those little tiny children. Like it's pretty rare.
Yeah, it's rare, but it's definitely something that people need to know about. It's real. It's not fake. It's real. And so let me give you a little bit of insight on it, because I think it's important to be aware. What it is they've connected it to textured implants more than anything else. Texturing means, so what is this? So implants the outside of the implant can be smooth or be rough like sandpaper. The smooth is called smooth implants, and texturing is like Velcro. And the idea of the texturing initially was that when you put texturing, this Velcro, it would cause that the capsule, which is the shell that forms around it, not to be as aggressive. We wanted to prevent capsular contracture. Okay.
Did it work?
No. So the other thing that texturing does is it prevents the implant from sliding around a lot. And so when you have gummy bear implants...
Don't you want sliding?
Well, no. If you have gummy bear implants, which are shaped, meaning they have a left, a right, a top, and a center, the last thing you want them is to move. When you have a round implant, you don't care if they move. You see the difference?
Yeah.
So bottom line is that they've correlated texturing with this lymphoma. And what they believe happens is due to the texturing and the friction that it causes on the capsule. What the hell is a capsule? The implant goes in your body makes a scar tissue around it. It doesn't matter what kind of implant. It could be a pacemaker, prosthetic knee, a heart valve, a chin, or whatever. And it's a thin scar tissue that envelops the implant. And it's just protecting you. What happens is some people's capsule gets irritated. It gets inflamed from all the rubbing of the texturing. And then they develop a lymphoma, a legit lymphoma. If it's caught and the capsule is removed, it's curative. It's done. It's not a lymphoma.
So what you're saying is setting off a lot of alarms in my head. So can I back up the train?
Sure.
So so let's just start with 300 people. All right. Rare. Then you're saying texturing. Then you're saying predominantly on gummy bears.
No, not gummy bears. Texturing, not. I'm just saying today.
Then you say they put texture on the gummies to hold them?
I'm giving you an example of gummies, yes.
Yeah, so I'm not saying that the 300 people all had textured gummies. I'm just saying texturing. Okay. So, and then the gummies are used on a lot of people because of the nature of the gummies who have already had some form of cancer.
Correct.
So I would be curious, just putting it out there, to know how many of the people had already had cancer, put in the textured gummies, and then had a specific cancer wrapped around the gummy. Okay, logic dictates that potentially.
Very good point. The truth is, we know so little.
That's the point I'm trying.
ALCL at this point. All we know is that it's related to texturing.
Okay.
And the reality is, in my practice, my augmentations are 99% smooth. And all we know is that it's incredibly rare, and how it generally presents is swelling around the breast, because the breast generates some fluid. That fluid is usually a sign that they're developing. That's the sort of the clinical thing. How do I know I have this? Just because I have texture doesn't mean you get it. You develop fluid around the breast, it gets larger, and then that's how we move forward. So you're absolutely right. A lot of work needs to be done, a lot of investigation. As a result, I don't really use texturing anymore. And the fact of the matter is that it's something you need to be aware of. Would I run out and be alarmed? I don't think the information should generate panic. It should generate.
You're just putting it out there.
So generate intelligence. And as a result,
I wish things generated intelligence, Dr. Raban.
I'm generating information which in turn could generate intelligence if you choose to use it. So I think these are some of the real issues with breast implants. I know we've just, no pun intended, we just touched the surface.
Yeah.
But I think it's really important to know breast implants inside and out. And at the end of the day, you have to connect with your surgeon, find someone you trust, someone you like, someone you believe in, to help guide you in picking out the right implant for you.
It's hard to believe that, as you say, we've just touched the surface on implants, but it's been over 30 minutes on this topic, on this particular episode of Plastic Surgery Uncensored with Dr. Roddy Raban. We're wrapping it up now, but I'm certain that we're going to come back to this at another time.
I'm sure too.
We've generated some intelligence, maybe?
God willing.